Have you ever noticed that some parts of your skin are looking darker than it used to be? It can be your forehead, your cheek, or maybe your neck is looking darker than your face. And after noticing this, you will go online, go on TikTok, go on YouTube, you search for different ways to treat it. You get vitamin C, niacinamide, fabutin, exfoliating toner just to treat it, and you see that it's not working. That dark patch or that dark part of your skin is called pigmentation, and most of the time it's sun-induced pigmentation when you're exposed to the sun. So in this video, we're going to talk about how to treat it, the right ingredients to use, and how to use it in your routine. The first thing I would love us to talk about is why the sun causes pigmentation, because I want you to understand what's going on underneath your skin before we talk about the products to treat it. So your skin contains cells called melanocytes, and this melanocyte produces pigment called melanin. I'm sure you've heard of melanin before. So the main job for melanin is to protect your skin against UV radiation. So when you expose your skin to UV radiation, your skin basically receives a signal that I need more protection. So your skin cell, which is the melanocyte, is going to produce more melanin to protect your skin against the UV radiation. And when it produces more melanin, it makes your skin look darker. So if you repeatedly expose your skin to UV radiation, your skin is going to repeatedly produce that melanin, so your skin is going to get darker with time. So now you understand how the whole process works. It's not like the sun just wants to give you pigmentation. It's your body's signal. It's your body signaling the cell in it, like the skin needs to protect itself from this UV ray, because UV rays can damage your skin. So it's just your body signaling your cell like, okay, produce more melanin to protect the skin. Now let's talk about the products you need, and I'll be starting with sunscreen, which is very, very important, because I've noticed a lot of you always focus on treating the pigmentation you have instead of also thinking about how to protect your skin against new ones. So for sunscreen now, you need a good sunscreen. So I recommend you use a sunscreen with nothing less than SPF 30. But if you even have a serious pigmentation, I recommend you use nothing less than 50 plus. And if the pigmentation is very severe and stubborn, I recommend a tinted iron oxidized sunscreen. Because when you're trying to treat pigmentation, sun is not just the cause of pigmentation. Exposure to light can also expose your skin to UV rays, which will cause pigmentation. Make sure to wear your sunscreen and reapply it every day, especially when you'll be exposing yourself to the sun, you are going outside. If you are going outside, if you can wear an hat, wear your sunshade or umbrella or something, just protect your skin, like an extra protection while using your sunscreen. You will need it. So now let's talk about the ingredients you need to treat pigmentation. But I want you to understand that not all ingredients works the same way. Some ingredients are going to help reduce melanin production, some are going to help reduce transfer of pigments, some are going to help reduce inflammation, some are going to help with skin cell turnover, which is going to make the pigmented cells shed gradually. So we're going to talk about all the ingredients and how they work. So the first ingredient we're talking about is vitamin C. I know this is very popular. So vitamin C is an antioxidant, and it's also useful in treating pigmentation because it interferes with melanin production while also protecting your skin against oxidative stress in your environment. So you're going to see vitamin C as part of your prevention and brightening ingredients. So you're going to use your vitamin C in the morning. After cleansing your skin, you apply your vitamin C serum, your moisturizer, and your sunscreen. Don't forget your sunscreen. So the next ingredient we're talking about is niacinamide, which is a vitamin B3. And this ingredient is my favorite because of how it works. So when it comes to pigmentation, niacinamide works by reducing the transfer of melanin to the surrounding skin. So you know, after your skin cell, which is the melanocyte, produces the melanin, so niacinamide is going to keep it in that skin layer and stop it from coming to your skin surrounding, which is this outer layer we are seeing. Niacinamide is literally preventing pigmentation. And the sweet thing about it is that you don't even need a high percentage of niacinamide for that to work. A little percentage, like your 5%, 2% niacinamide, can do the trick. And niacinamide can be in your moisturizer, it can be in your serum, it can be in your essence. So if you are treating pigmentation, I recommend you use niacinamide as part of your routine. Not just if you are treating pigmentation, niacinamide should be a part of your everyday routine because of how it works. So when you are using your sunscreen and even when you expose your skin to the sun, it's going to help reduce the transfer of that melanin to your surrounding skin. So the next ingredient we're talking about is azelaic acid, and this one is very good because aside interfering with melanin production, it also has anti-inflammatory property. So if you had acne before and that acne left a spot on your skin, this is going to treat it. Like, it's going to treat your acne and also treat that spot. But let's talk about sun-induced pigmentation. So for sun-induced pigmentation, azelaic acid contains an enzyme called tyrosinase. So this enzyme is going to slow down the production of melanin, which is going to reduce pigmentation on your skin. So you can see it has a lot of benefits. It's going to work on your sun-induced pigmentation, your acne mark, your dark spots, and if you have sensitive skin, is also recommended. So azelaic acid can be in your cream, in your gel, in your serum. Like, it comes in different form, mostly from 10% upward. I'm not sure I have seen any azelaic acid products that has less than 10%, so like 10% upward. And you should use this ingredient at night and not every day. So the next ingredient we're talking about is your retinol, and retinol comprises of your retinol, your adapalene, and your tretinoin. So this retinol works by increasing your skin cell turnover. So when new skin cells are regenerated, the old skin cells are going to shed off. So part of those old skin cells are your pigmented cells, and those pigmented cells are going to shed off. That's how it works for pigmentation. But one thing about retinol is that it can cause skin irritation. So I don't really recommend it if you have sensitive skin. Like, it's the least ingredient I would recommend for someone who is battling with pigmentation or you have sensitive skin, because it can cause inflammation, like your acne breaks out, and these things are also going to leave like a spot and mark on your skin. But if your pigmentation is very severe and you want to use this ingredient, I will advise you start with small and a pea size. You're not putting like a lot. No, this is not where you say, okay, a lot of these ingredients, a lot of this cream or serum is going to work faster. No, you just need like a pea size of it on your skin, and use it like 2 times in a week, not every day, and at night. And whenever you're using retinol, make sure to use a good moisturizer, because it's likely going to dry out your skin. And don't forget your sunscreen the next morning, like every morning. Don't forget your sunscreen. Apply your sunscreen and reapply your sunscreen throughout the day. So you're going to use your retinol at night. I think I've stated that before. You're going to use it at night. After cleansing your skin, you apply a moisturizer, then apply your retinol and apply your moisturizer again. That's how it's going to reduce the inflammatory effects on your skin. And note, if you are pregnant, do not use retinol. It's not recommended. It's not recommended by dermatologists. If you are pregnant, do not use retinol. So the next ingredient we're talking about is alpha-arbutin, which a lot of us know. Like, it's one of my favorites. So alpha-arbutin is a derivative of hydroquinone and can also be used as a tyrosinase inhibitor. So this is like going to reduce the pathway of melanin production. So it's going to slow down the rate of melanin production on your skin. And it's actually very easy to incorporate in your skincare routine, and I highly recommend you use it at night, but you can also use it at day, depending on your skincare routine in general. If you're using it as a serum, so after cleansing your skin, you use your alpha-arbutin serum and your moisturizer. It's very good for sensitive skin. It's not going to inflammate your skin. It's a very good ingredient. The next ingredient we're talking about is kojic acid. So kojic acid is a very good active when it comes to treating pigmentation, and like, it's very active when it comes to treating pigmentation. It's going to fade your pigmentation gradually. And if you're using this, you use this at night and not every day, like 3 times in a week, not even 4. Or depend on your skin sensitivity. So you can use like 3 to 4 times in a week, and that's nice. And don't forget to use your sunscreen. So this ingredient can be in your serum, in your cleanser, in any other form, depending on the form you choose to use it at. So the last ingredient we're talking about is your exfoliating acid, because there's no way you'll be treating pigmentation and you're not exfoliating your skin. So when it comes to treating pigmentation or trying to brighten your skin, you use the AHA, the alpha hydroxyl acid, and the 2 recommended are glycolic acid and lactic acid. There are other AHA ingredients you can use, but yeah, we're talking about the glycolic acid and the lactic acid. So this is an exfoliating acid that is going to help reduce pigmentation on your skin over time. So you're going to use it like 2 or 3 times in a week and at night. Note that any strong active you are using should be used at night, not during the day. So this exfoliating acid can be in the form of your toner or your serum, but make sure you are using it at night, and don't forget your sunscreen the next morning. So we've talked about the ingredients you need to treat your pigmentation. I talked about some active, but one thing I didn't say about the actives is that I talked about like 3 to 4 strong actives. Those actives, you should not use them the same night. Let's say if you're using your retinol today, I will not recommend you use your retinol and your azelaic acid the same night. Though some people do it, but to be on the safe side, I recommend you use them at different nights. So if you're using your retinol today, you can use the azelaic acid tomorrow. Then the next day should be like a recovery day. Leave your skin, allow your skin to breathe. Then another key thing about treating pigmentation is that you need to hydrate your skin. So I recommend you use an essence or probably an hydrating serum. A serum that contains snail mucin, your hyaluronic acid, because when your skin is hydrated, it also helps with treating pigmentation. So that being said, in my next video, I'm going to talk about how you can pair these ingredients to treat your acne or your pigmentation. So you want to subscribe so you will not miss out on that video. See you in my next video. Bye.